My name is Caitlin DeGrace, and I'm a nursing student at the University of Michigan. My patient is FJ, and she has been staying at the Heartland Center in the Beach Unit for a chief complaint of acute cholecystitis for about 4 years. HPI. The patient is a pleasant 63-year-old African American woman. She first sought care at the University of Michigan Hospital on September 11, 2013, for right upper quadrant pain due to cholecystitis. She declined surgical intervention and was discharged on September 14, 2013, to Heartland for rehabilitation. The patient states pain started a week prior to admittance and that her consumption of foods high in fat caused the pain. Her pain lasted about an hour and was relieved with drinking fluids. The patient rated the pain at a 7 on a 0 to 10 pain scale. The patient was admitted to University of Michigan again September 28, 2014, for a small bowel obstruction. She underwent a small bowel resection and was then discharged back to Heartland on October 2, 2014. The patient stated the pain was sharp and gave her cramps. It was sudden in onset but lasted approximately an hour. The patient rated the pain that the pain induced was a 10 on a 0 to 10 pain scale. The pain wasn't completely relieved until after her surgery. In addition, the patient also suffers from obesity, hypertension, gastroesophageal reflux disease or GERD, neuropathy, depression, and type 2 diabetes. Psychosocial data. The patient revealed her family dynamics are in good condition. The patient has 2 daughters and 3 grandsons who come to visit her quite frequently. For interpersonal relationships, the patient used to live with her daughter and grandson before coming to Heartland and greatly enjoys their company. The only stressor she reported in her life was that she didn't like how the staff at Heartland would go through her drawers and move things around that belonged to her. She also reported there are no environmental hazards. The patient is very spiritual, a devout Christian, and listens to a gospel music CD every single day, as well as attends church every Sunday. The patient never went to college. In regards to family history, the patient's father had type 2 diabetes and died because of the disease, and also her sister has hypertension. The patient is up to date on all vaccines as of current, but had measles, mumps, and chickenpox as a child. She is allergic to aspirin, morphine, and NSAIDs. They cause ulcers, itching, and gastrointestinal distress, respectively. For functional assessment, the patient reports no current alcohol, drug, or tobacco use. The patient cannot exercise due to being bedbound and needs assistance of a Hoyer lift and a motorized wheelchair to get around. She also has a healthy appetite with plenty of fluids and a good nutrition. The patient's sleep pattern is regular. She sleeps well at night, approximately 8 hours, as well as takes a daytime nap. The patient describes her health as good, but is unsatisfied with it because she's still at Heartland. For vital signs, her heart rate is 90 beats per minute with a respiratory rate of 18 breaths per minute. The patient's blood pressure is 140/90 with a temperature of 98.7 degrees. Physical examination. The first system I chose to examine is abdominal. I chose this because of the patient's history of a small bowel obstruction and acute cholecystitis. Upon inspection, the color and shape of her abdomen was consistent with her ethnicity and diagnosis of obesity. No hernia in the umbilicus region was noted, and no surface movement or motion was detected. Her abdomen was symmetrical with no bulging, masses, lesions, or scars visible. When questioned on a review of systems, the patient reported a change in her appetite as well as indigestion. The patient reports abdominal pain and nausea, but no blood present and no bowel movements or fever or chills. The patient also reports no rectal bleeding, suprapubic pain, or incontinence. She hasn't had any intake, no 24-hour weight change, as well as no bloody stool. Upon physical examination, the patient did not have any abnormal findings when looking at the abdomen, but experienced tenderness in right upper quadrant as well as a positive Blumberg test, which is rebound tenderness, in that area. The patient also had a positive obturator and iliopsoas test on the right side, and upon auscultation, there were hypoactive vowel sounds present. The second system I chose to examine is the peripheral vascular system. I chose this because of the patient's history of neuropathy and type 2 diabetes. While inspecting the patient's lower extremities, I noticed no discoloration. I did note immense swelling as well as a small pressure ulcer on her left leg. Her capillary refill was tested as normal with blanching and brisk return. She is bedbound, so I was unable to assess if she experienced pain while walking, though she states that when she used to be able to walk on her own, it would cause pain in her hip, knee, and ankle joints. The patient had significant edema and swelling graded at a 3 plus. Hair loss is present on the legs, as well as she has a history of blood clots and varicose veins in legs. Her pulses were weak and easily occluded with minimal pressure, graded at a 1 plus. My first pertinent system is the integumentary system regarding her obesity and intestinal obstruction. According to Dr. Schlebert of the University of Pittsburgh School of Medicine, it is stated, obesity is associated with morbidity and mortality through endocrine and mechanical processes. Clinical manifestations due to the effects of obesity on the integumentary system have been described as debilitating. My second pertinent system is the musculoskeletal system regarding the patient's obesity. According to doctors Caterson, March, Franson, Sambrook, and Anakamasura from the International Journal of Obesity, it is stated that obesity is associated with a range of disabling musculoskeletal conditions in adults. Weight reduction is important in ameliorating some of the manifestations of musculoskeletal disease and improving function. This concludes my assessment. Thank you.